Hi, and welcome to the final video in the Maternal Health webinar series presented by Security Health Plan. Knowing your patient rights during pregnancy, delivery, and postpartum is crucial because it empowers you to make informed decisions about your care and ensure you receive respectful, safe, and appropriate medical treatment. In this video segment, we will help you understand your rights as a patient. Let's get started. You have the right to get a second opinion. It is not offensive to ask your provider for a second opinion if you are having doubts or are curious about alternative options. Get the necessary information and clarification you need before deciding on a procedure or care plan. There are many benefits to getting second opinions. You can get exposure to different perspectives, avoid misdiagnosis, learn more options and solutions, and reduce stress and feelings of uncertainty. You have the right to change your provider and adjust your care team at any time. If you have a negative experience, aren't being listened to, or not being taken seriously by your provider, you have every right to ask for a different one without any consequences. Not every provider is the right fit for you, and that is okay. Historically, pregnant people often leave healthcare settings feeling unheard, and this is especially true for Black, Indigenous, and other non-white pregnant people. When it comes to something as serious as your labor experience, it is important that you feel comfortable and confident in your care team. Lack of trust can have detrimental effects that contribute to many maternal disparities. To find a new provider, contact your insurance company, use the Security Health Plan website, ask your current provider for a referral, or ask your support people for recommendations. Once you find a new provider, be sure to have your medical records transferred. You have the right to ask questions. Medical terminology can be confusing. Ask your doctor, midwife, or doula to explain anything you might not understand. Every question is a good one if it leads to you better understanding what is happening during your pregnancy. Asking questions early on can better prepare you for asking the hard questions if your pregnancy or labor becomes an emergency. Write down your questions as they come to you. That way you can refer back to them during your next appointment. You can ask questions like, is this an emergency? What happens if we wait? What are all my options? I'm not sure that decision works for me. Can you explain it further? And what are the risks and benefits? You have the right to culturally responsive care, respect, and dignity. Culturally responsive care respects the values, cultures, and traditions of all patients, regardless of their race, ethnicity, gender identity, sexual identity, age, class, or socioeconomic status. A culturally responsive provider may not share your same background, but is respectful and empathetic towards it. Cultural responsiveness affects all pregnant people, but especially those from non-white backgrounds. A 2024 CDC survey found roughly 30% of Black, Hispanic, and multicultural pregnant people report experiencing mistreatment during pregnancy or delivery. LGBTQIA+ patients are twice as likely as non-LGBTQIA+ patients to report negative experiences while receiving health care, according to a KFF survey. Providers with limited English proficiency who speaks the patient's primary language is associated with fewer medical errors and better outcomes. A good provider will listen, respect you as a human capable of making the best decisions for your body, and know how to admit when they have made a mistake. Trust your gut if you feel you are not receiving quality care from your team, and talk to your support people if you are feeling unsure. Working with a culturally responsive medical team is an important first step in ensuring you have a healthy pregnancy and a safe delivery, especially for Black women who are more likely to face barriers to quality care. Monica Mitra, PhD, Director of Lurie Institute for Disability Policy, says people with disabilities are often stigmatized, discriminated against, and discouraged from having children. For these people, she says, culturally responsive care may mean finding a practitioner who is able to treat them with the same level of care as a patient without disabilities, as well as someone who has experience with that patient's specific disability. You have the right to a positive birth experience. You can make the delivery room as comfortable as you would like by bringing your own pillow and blankets, keeping the lights low, or playing soft music. You can also request that your care team cluster their cares instead of coming in multiple times for different checks, having as few cervical checks as possible, and have a portable monitor so you can move freely throughout your room. It is important to identify the difference between hospital policies and preferences. Members of your care team may deliver care a certain way because it is a hospital policy, but they may also be doing so because it is how they prefer to deliver care. For example, some care teams will check your cervix after a set time, but you may want to limit cervical checks altogether to limit the risks of infection. You can communicate with your providers to let them know you would be more comfortable with less cervical checks. As long as the labor is progressing, that request is reasonable. Set your environment to create the best experience for yourself. You can do so with dim lighting, wearing comfortable clothing, using essential oils, having fresh flowers, playing music, laughing, and dancing. Your care team should want to work with you so that you can look back on your birth with joy. All too often, the focus is more on the baby than it is on the person giving birth. Do not be afraid to pull focus to yourself. You are the most important person in this process. You have the right to feel and express your emotions without guilt or fear. Mental health during pregnancy can feel like a roller coaster. You are entitled to the space to process emotions during this journey, which also applies to feeling pain. Do not worry about how people may perceive or misinterpret your feelings. This is not your responsibility. You have the right to know all your options and think about them before making a decision. When something becomes an emergency, it is common to feel like you are given no time to react or make a decision. It is important you are given the necessary time you need to stop and think before making any decision, but especially one about taking immediate measures to ensure you or your baby's safety. You deserve the space to process what your provider has told you. You can also be proactive by talking about emergency scenarios such as an emergency C-section while you're in early labor or even earlier during one of your prenatal appointments. You also have the right to informed consent. Your provider should educate you about the risks, benefits, and alternative options of a procedure. Without this information, you cannot give informed consent. If you feel you do not have the full picture, ask more questions before giving written or verbal consent. This can be for anything as small as a care member pushing on your back to relieve pressure to larger procedures like manually breaking your water. Generally, a healthcare provider has a duty to disclose what a reasonable, prudent clinician in the medical or dental community would disclose to a patient. At minimum, this includes the patient's diagnosis, the name of the proposed procedure, a description and explanation of the procedure and its purpose, the names of all practitioners who will be involved in the procedure and the significant tasks of each, important risks and benefits, and alternatives to the proposed procedure, including no action. You must be competent to make a voluntary decision regarding whether to undergo a procedure or intervention. Providing informed consent requires assessing your understanding, making a clear recommendation with supporting reasoning, and documenting the process. Healthcare professionals must emphasize your active participation in decision-making and avoid creating any sense of coercion to agree with their recommendation. You have the right to change your mind. Your birth plan or chart is not binding. It can and should change as circumstances change. For example, you decided that you only want IV pain relief, but once you start labor, you can still request an epidural or go without medical pain management altogether. Birth can be extremely unpredictable, and while it is great to have a birth plan, know that decisions can be flexible as you go through the labor process. You also have the right to refuse. Your provider's word is not final. It is their job to help you create a care plan that works for you. If part of that care plan does not fit or you find uncomfortable, you can refuse it. If you do refuse, have open conversations with your provider so you can work together to find a more fitting solution. No right is held more sacred or is more carefully guarded by the common law than the right of every individual to the possession and control of his own person, free from all restraint or interference of others, unless by clear and unquestionable authority of law. You have the right to challenge or report mistreatment and discrimination. It is important to address mistreatment and discrimination. You can save yourself from the stress effects of being discriminated against, but you can also save others in the future by reporting the member of your care team if they mistreated you. Regardless of the outcome, holding that provider accountable for their actions is necessary to change their behavior. There are several reasons to report a provider or care team member for mistreatment or discrimination, including ignoring informed consent, overlooking pain, verbal abuse, neglect, discrimination based on race, age, weight, or income, violating privacy, or neglecting postpartum care. If you experience any of these, you can file a complaint with the hospital, medical board, or a patient advocacy organization to hold providers accountable and improve care for others. Thank you for watching the 4-part webinar series on maternal health presented by Security Health Plan. Every person deserves a safe and supported pregnancy journey. This mini-series was designed to inform, empower, and equip you with the knowledge and tools to navigate your pregnancy, confidently advocate for yourself and your baby, and understand your rights as a patient. If you have additional questions, please reach out to your provider or call Security Health Plan at 1-800-472-2363. Thank you.